Kicking things off, 2 Americans infected with the Ebola virus are receiving treatment in Atlanta today as the number of those infected with the virus continues to rise worldwide. Dr. Kent Brantley and aid worker Nancy Wright-Ball were working at a hospital in Liberia that was treating patients suffering from Ebola. The World Health Organization is confirming 932 deaths from the virus, with Nigeria and Saudi Arabia among the most recently reported cases. The question is, what is the Ebola virus? How contagious is it? Our next guest is here to tell us more about the deadly disease. We welcome now Doctor and Associate Professor at Mercy College, Rossi Hassad, and thank you so much for joining us here.
Thank you.
Thank you. So, as we're hearing a lot of questions and concerns, once again, on the part of Americans, now that you have these 2 persons being treated in Atlanta. For somebody who doesn't know about Ebola, let's first of all walk them through what exactly is the Ebola virus.
The Ebola virus is it's a pathogen, a germ. It's a microorganism. It's microscopic. You can't see it. It comes from a family of viruses, probably about 5 subtypes or specimen, and they all have varying degrees of lethality, the extent to which they are severe on your immune system. What viruses do, they have a genetic code that send a message to your immune system to stop working so they can invade. So this virus hijacks the immune system and overwhelms it. So there's an almost complete shutdown of your immune system, leading to high fever, beginning with flu-like symptoms and progressing to worse or end stage where they can be severe hemorrhaging, leading to shock and ultimately death.
Mm-hmm. And so we're hearing from the World Health Organization, 932 deaths approximately contributed to the Ebola virus. Talk about being contagious and the fact that it is contagious. How contagious is the virus?
Well, there's a distinction needs to be made between infectious and contagious. It's an infectious disease. There's an organism, a germ, that conveys or transmits. Contagious comes from the word contact, making contact with, and it is contagious, but not readily contagious, as in the flu, where it can be transmitted via the air. This is not an airborne disease. It's not a foodborne, it's not airborne, it's not waterborne. In theory, it could be airborne, but clinically, the evidence doesn't support that we have had cases that could be categorized as airborne.
Mm-hmm. And there's a lot of fear, and on the part of people all across the world about just the virus and its spreading. How difficult, or how difficult has it been, or is it to contain?
Well, it's proving quite a challenge now. This virus has defied common principles of epidemiology in terms of where it comes from and how it progresses. We really don't know the primary source or reservoir of this virus in terms of the chain of infection. Best evidence suggests that it probably comes from the bat and then moves to larger animals, and then the population has access to those animals. Mm-hmm. But as I said, one of the factors that inhibits the control of the spread is more of a behavioral factor, and that is our cultural practices and beliefs in certain regions of the world, which may not lead to adhering to health education messages and so forth.
Mm-hmm. So when we look at America, we know that we have our own set of challenges, but the 2 doctors are being treated in Atlanta for the virus. When you look at Americans, what can Americans do to be on the lookout, to watch out, to possibly just, become more informed?
Indeed, it's a major concern in West Africa. In the United States, the concern should lead us to educate ourselves and become more prepared. Our level of health infrastructure and health resources can take care of containing or controlling a spread. We have 2 cases on U.S. soil right now, not infected here. They were affected overseas, and they became infected overseas. And I am fairly confident that will remain too. Mm-hmm. Now, we can't avoid having a case. It's likely that a few cases will come up, but I think we have effective surveillance measures to catch that early and contain it.
So the concern and the fear on the part of Americans really shouldn't be as large as people are making it out to be?
No, I would say no, it shouldn't be. The concern should be one to lead us to become more educated, aware, and prepare.
Mm-hmm. So give us a little bit more about how the disease progresses, because I think that's what's catching people, somewhat, because if you don't know how to contain it, you hear that this virus is spreading. Give us a little bit about how the disease progresses.
We've seen these scary stories, heard these scary stories, seen these scary movies and documentaries. And Ebola itself has a frightening song, just the word Ebola. And that comes from the river, Ebola River, close to the Sudan and Congo in 1976, where the virus was first identified. Hence it was named Ebola. It progresses, I must say, beginning with flu-like symptoms. So, and that's the problem why it's also difficult to identify and control, because the early symptoms are similar to common infections. Right. So, but it progresses beginning with flu-like symptoms to febrile and becoming weak with high fever, leading to organ failure, hemorrhaging, shock. But you can treat those things. There is no vaccine, there is no specific cure, but you can treat the presentations or symptoms of the patient. So you can treat shock, you can treat fever, you can treat pain. So that's the type of therapy that's being used, supportive therapy, to maintain the vital functions of the patient.
So give us a little bit about the two doctors. How are they being treated right now from your estimation with what they've got?
Well, they're receiving supportive therapy. Again, similarly, as I said, electrolytes, maintaining their electrolytes, their blood pressure, their vital functions. But from reports we've had, they're also receiving an experimental therapy. They've received a few doses of an experimental therapy, and that is very early in the experimental phases of research. What that does, it helps to boost the immune system. So you can maintain the patient until, hopefully, the person's natural defenses can kick in. So their treatment is addressing trying to maintain their vital functions, but in addition, they have been fortunate to have access to this experimental treatment that's and again, we don't know the effectiveness of that, because that's the tricky nature of Ebola. You can be doing very well today, and tomorrow you relapse.
So for people who have the Ebola virus, there's this common feeling that it always will lead to death. True, not true?
No, and increasingly we are seeing better survival rates. We used to talk of a survival rate, a case fatality rate of 90%, meaning almost 90% of those who become infected will die. But it depends on the strain of the virus that you're infected with and how early treatment is provided.
Well, as we look at the graph here, we do see the number of outbreaks has increased. And also, when you look at the survival rate, it looks as though this year we're seeing a lot more people survive through the Ebola virus as well.
Correct, and that's what I was saying earlier. You can treat the symptoms, the supportive therapy here, and given the heightened awareness and preparedness, we will begin to see improvement in the treatment, diagnosis, treatment, and prognosis.
And before we go, Dr. Hassad, please give people some information as to where we can go to find out, besides we can become more informed and not necessarily put everybody on scare alert. Where can people go to find out more concrete and factual information?
The national authority is the Centers for Disease Control, which is cdc.gov, the National Institutes of Health. And here in New York, we have a very equipped New York City Department of Health. We have a very modern infrastructure in terms of our surveillance measures.
Okay, well, Dr. Rossi Hassad, thank you so much for coming and sharing with us, giving us this much needed information. Thank you. Of course, we will continue on our show, taking a quick break, but when we return, we'll discuss the latest in the political world. Mark Myritz will join us right after the break. Stay with us. We'll be right back in a few.